Hello, everyone, and welcome to the Babies in Common show. I'm Jeanette.
And I'm Melissa. Welcome, listeners.
Please take note that any information shared during our show today is not to be taken as medical advice. Please consult your own care providers, as always, for questions about you or your baby's health, and visit babiesincommon.com/disclaimer to read more.
And before we get started with our show and our wonderful guest today, I'd just like to ask you all to consider visiting our website, babiesincommon.com. There is a link to a petition that Jeanette and I have started, and it's in support of asking Governor Baker to stop the separation of birthing families in the hospital. So please go to our website, babiesincommon.com, to learn more about it. Jeanette and I made a video that explains the types of things that are happening in some Massachusetts hospitals, not all, but some pretty big and pretty important hospitals where pregnant people are being separated from their support person, either during labor evaluation and triage, for an antepartum high-risk hospital stay, or sometimes also for an early part of an induction process. So this is happening at some hospitals in our state, and we're trying to get them to change. If you would consider visiting babiesincommon.com, clicking on the link to read our petition and watch our video and share with your friends and family. Thank you.
Alrighty, so today is Wednesday, January 13th, 2021, and our guest today is Kara Coffin. Kara's a mother of 3, plus she's got 2 dogs, 10 chicken, and 1 fish. Kara holds a master's degree in speech language pathology and used to work with individuals living with brain injury. She's blended that experience with her certifications as a personal trainer, perinatal fitness specialist, and childbirth educator to create a coaching program that she'll tell you more about today. She specializes in guiding pregnant people to co-create a toolkit of physical, emotional, chemical, and spiritual supports to call upon throughout pregnancy, labor, and postpartum that honors their autonomy. And we are all about autonomy, that's for sure. So welcome, Kara.
Thank you. I'm so excited to be here.
I am excited to have you on the show because I get a lot of inquiries as a visiting nurse. I work with home birth families, as many of our listeners might know, about, hey, it's my 3rd, my 4th, my 5th baby, or sometimes even after your 1st. And I'm having all of these issues that might be related to my pelvic floor, but how do I get back into shape in general? I'm feeling cabin fever. I want to start exercising again, but I just don't know how to do that with all the changes that have happened in my body. And so I'm super excited because I love having resources to direct people to. So I can't wait to hear your answers to our questions.
Great. I'm so excited.
At what time in this, the last 5 years, did you kind of come into this perinatal fitness specialist role? How did you make that transition?
Yeah. So after I had Quinn, and I wanted to just sort of like reconnect to my body and stuff, I learned all of these things about breathing and your pelvic floor and your diaphragm and all of these things that I feel like people should know.
And where were you learning this type of information?
So there's a lot of really great certifications online that I've taken, like everything I can possibly find.
So they were like professional certifications?
Yes. Yeah.
And you probably, you're a speech and language pathologist. So was it that you kind of had friends that maybe were physical therapists and whatnot that kind of led you to that? Or did you just do a lot of your own research?
A little bit of both. Yeah. And at the beginning, it was a lot of doing my own research. And then as I got more like invested in sort of the field and made some connection with some PTs and stuff, I took some of the courses that they recommended as well.
Awesome.
Yeah.
And at what point in this last 5 years did you become a fitness instructor, like a basic fitness instructor?
Yeah. While I was pregnant with Evie, I got my certification as a PT, a personal trainer.
Do typical personal training programs talk about pregnancy and give you what you need, or did you have to really go for extra training to become a perinatal fitness specialist, so to speak?
Oh, yeah. So I am a NASM certified personal trainer, and in the NASM text, and I don't think there was one question on the exam, but in the text, there are 4 pages on working with pregnant and postpartum people.
Sure.
And is that information accurate? Do you remember?
It's so outdated and not helpful at all.
Yeah.
It's like making sure your heart rate doesn't go above 140 beats per minute, which is
not evidence
advice and not evidence based. A lot of stuff like that just is really not helpful at all. No talk about your core, no talk about your pelvic floor, none of that sort of stuff. So everything that I've done since then has been like hours and hours and hours of coursework and certifications. And a really big focus on like, I have a certain scope of practice. I try to collaborate with physical therapists as much as I can, because I can do a lot of things, but I'm limited as to what I can do, with someone, as far as like internal examinations and that sort of thing, and being
Sure.
hands-on. So I think that's really important as well. But a regular PT certification gives you nothing.
Right.
Yeah.
That's what I thought.
Yeah.
So what do you feel the role of fitness in pregnancy is? Because people that, we're in a pretty health conscious state. A lot of clients that I work with at all the hospitals, or even the home birth midwifery practice that I work with now, are wanting to know, how do I stay in shape when I'm pregnant? Because there are so many benefits, physical, emotional, mental benefits to exercising in pregnancy. It can lower your blood sugars, especially if you have gestational diabetes. It just in general helps all of these body systems that are really changing in a big way, your cardiovascular system, hemodynamically, staying fit. And even if it's just a 30-minute walk, I mean, can do a lot to help loosen up joints and just prepare your body for the growth of pregnancy and the work of labor and birth. But, fitness is a little bit different than just like a 30-minute walk after lunch, right? So what do you feel the role of fitness in pregnancy is?
Yeah, I mean, it's so nuanced. There are so many benefits, like you said, like decreased aches and pains and shorter pushing phase of labor, a more robust placenta and better quality of sleep, all these really wonderful things and benefits for you and your baby. But that being said, I think that having like a fit pregnancy can be like this slippery slope, especially given like our culture's investment in diet culture. So if you like type into Pinterest, pregnancy workouts, the top hits that you're going to get are how to have a belly only pregnancy, how to lose fat during pregnancy.
Wow.
That's dangerous stuff.
So yeah, and this is the information that people are being fed when they go to like Google a pregnancy workout. I mean, imagine seeing that as a pregnant person and just wanting to like move your body to feel better. So, pregnant and postpartum people aren't exempt from this grip of diet culture, unfortunately. And oftentimes they're like the target of diet culture. And I think this is so harmful, because I think people can lose touch with deep down, like what's the true motivation behind why they're moving their bodies during pregnancy when you're constantly being like bombarded with these messages. And is it truly because like movement makes your body feel better, or is it rooted in like seeing these messages constantly from diet culture and keeping yourself as small as possible and bouncing back as fast as possible and erasing like any evidence that you were even pregnant?
Right.
And I think this can be particularly hard for people with like an athletic history.
Yes.
So when you go to your doctor and you say like, oh, can I still work out? Most of the time, what they're going to tell you is, yeah, just listen to your body, do what you've been doing. Like you're going to be fine. But if you have a history of being an athlete, you've basically been like, or you've been like entrenched in this fitness culture for a long time, you have been trained to sort of like push through your discomfort, push your body beyond its limits. And in essence, we're kind of like training ourselves towards hearing our bodies, but like totally disregarding the messages that your body's sending you. So
thank you for saying that,
Yeah.
because that is something that I, especially when I worked in the Cambridge area and everybody runs marathons. I mean, when I worked in upstate New York, I would use this whole, labor's like a marathon as an analogy for, something was hard work, right? And people kind of got that, right? But when I moved to Cambridge, and well, not moved to, but when I worked in Cambridge, and I would say, labor's like a marathon. And people would be like, where's the marathon? I'll train for the marathon. I will run that marathon. I'll beat that marathon. They were, and I was like, whoa, wait a second. No, labor is not like a marathon at all. I'm sorry I even said that, because, and this whole listen to your body, you're right. People, especially if you're an athlete, especially if you are, pretty intense about your workouts. I see a lot, I don't want to like name names, but I know a lot of CrossFit patients that I have, they're used to pushing it beyond. And, I would kind of start the conversation when I would counsel people like, this isn't the time to get your personal best. This is not, when you start, and my sister, she actually did run a marathon I'm very impressed with her. But when she got pregnant, you know, she was saying, I feel so out of shape. I feel so out of shape, right? Because she was feeling slower and she was having shortness of breath with like walking from the car to Target. And we talked a lot about, it's not that you're out of shape. I know that those sensations that you're feeling right now remind you of times in your life when you weren't really feeling that you were at your best, you know, cardiovascular wise. But that's not what's going on here. You made 50% more blood that you have to oxygenate with half of the lung capacity, right? And so I think that people feel like, oh, I'm getting out of shape, I need to push it harder. So you talk about, you know, wanting to help people feel supported in their full humanness during pregnancy, birth, and postpartum. So can you talk a little bit about what you mean by that?
Yeah. I use this terminology a lot, and I love this question. So where to start? So because this like medical model of care is primarily the way that people get their care during pregnancy and postpartum, there often just isn't a lot of room for providers to like see people as fully human. You're just like a body that comes into the room. There's not like this deep level of connection and seeing people's lived experiences and what they need for support and like truly seeing them as like a human.
Wait, they're not just incubators for fetuses? I just want to be clear.
Yeah,
we're humans when we're pregnant.
Believe it or not, yeah. So not all providers, you know,
no, of course.
And it's definitely not their fault. It's often just like the way the model is set up that they just don't have the time or the training or like the support to be able to hold people in that space. And it's so I talk about this all the time with people. In my 2 hospital births, I had a lovely OB, but she didn't deliver my baby. I had no idea who the people were in my room. I like rolled up into the delivery room. There were a bunch of people there and masks and gowns and all that sort of stuff. And they didn't know anything about like my lived experience of trauma. They didn't know what I needed for support. And it just feels really like robotic. Like where's the humanness in that?
But I think even the language that we use, and I'm trying to get away from it, but is that what you just said, like didn't deliver you, like that right away takes one step away from your humanness because you're delivering the baby, they're catching the baby, maybe they're handing the baby to you, maybe not, you know, but you're giving birth, even like even just not saying I'm delivering my baby, I'm giving birth to a human as a human, and these other humans are helping in this process,
right?
You know, but it's become like these words that we use or are used in the medical world have been adopted by our culture as common, and so we don't think about it like that's a whole other, we did another whole episode on words we use.
Language is super important. I think there's also this other side to it that people just don't feel comfortable, or perhaps they just don't feel like they have the permission to talk about like the normal human parts of pregnancy and labor. We like play into this narrative that you're glowing and you're this goddess and you're like this immensely grateful vessel of life. And like, yes, I am grateful for that experience of carrying my babies and delivering my babies. But also when I was pregnant with a toddler, I did a lot of just like lying on the floor with letting them crawl over me. And I was so exhausted and nauseous, and like, there's room for both of that. There's room for not enjoying being pregnant. There's room for struggling with your changing body. There's like vomiting, pooping, shaking during labor. All of those things are fully human and normal. And I all too often hear people like, oh my God, did you hear that so-and-so was throwing up in labor? I'm like, yeah, like a lot of people do. That's totally like a thing that happens. And it's because we're humans and there's like a lot going on in your body. So I think that the more people talk about this, the better. And the more that we recognize these things as like normal human processes of pregnancy and birth and labor, the better. So,
absolutely.
Yeah. I mean, like, how often does somebody, like, you ask somebody, like, when you're pregnant, like, how are you feeling? And the answer is always like, oh, I feel okay. I feel great. Or like, oh, I have some like lower back pain. When if you actually were honest with them and said like, I hate being pregnant, this is awful, and I just hate it, like they would just be like, well, hold up, like, that's too much for me. So like, can we bridge this gap of like allowing pregnant people, postpartum people, just all people, but especially during this super vulnerable part of your life, to just like express your full human self.
Yes. Preach, 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 preach,
I
preach.
agree.
All right. So you were keeping yourself healthy. And so how did you feel like with Evie's birth and pregnancy that working out helped you? And then what did you do to prepare your third that was even more different than what you did with Evie? Because along this process, you've been learning more about the body and the pelvic floor and how the muscles work together. And so how did that evolve?
Yeah. So with Evie, I focused a lot on diaphragmatic breathing, on getting in tune with my pelvic floor and knowing how to coordinate those movements, contract, relax, all that sort of stuff, which helped me, I think, remain more focused during my whirlwind labor of like opening and releasing my pelvic floor muscles and all that sort of stuff. And then also like pushing more efficiently. So I think that stuff can help. And I think there's also an element that just like your genetics and your body are your body. And there are things we can do to help, but also like, I think I don't think that my working out had anything to do with how fast my labor was. I think it's just my body.
Sure.
Just to make that distinction.
Yeah.
So
no, and there's also people, and Melissa, you can speak better to this as someone who's been with lots of different types of people. I mean, I've attended some births as well, but not as many as Melissa, for sure. So, but that when people are so fit and they've got like 6-pack abs, that like there's something about that tension in the body where they're like, I'm so used to keeping everything tight.
Yep.
Yeah.
They haven't
I'm super nervous about CrossFit moms. Again, I'm not picking on, I know there are other workout programs that are that type of program, but whatever that program is called, when people are horseback riders, when people are gymnasts, when people when people are still doing, I had a person take my class once, and she came up at break and she showed me, because we were talking about like how important movement is in pregnancy and labor to cope with labor and birth, and that mom and baby are active participants. So she took this as an opportunity to kind of show me, oh, look what I can do. And she showed me a picture of her like the week before. This woman's like 34 weeks pregnant, deadlifting like a massive amount of weight. And I was like, whoa. I didn't want to make her feel bad because I mean, she's obviously trying to like brag a little bit. And I'm not saying that in a bad way, but I was like, I'm actually super concerned that you're deadlifting that amount of weight. And she's like, what do you mean? It doesn't cause any. I'm like, no, I'm not saying you're going to cause the baby to have a miscarriage, but you're 35 weeks. What I'm saying is you are holding so much tension in your pelvic floor. If you're still doing deadlifts at 35 weeks, like we need to talk about, I'm not, and I feel like when I try to have conversations with people that are super focused on their particular fitness in a very like, I'm a super fit way, not in a wellness way. They kind of get defensive, like, well, pregnancy isn't a disease, and I'm not going to slow down just because I'm pregnant. This baby's not going to change anything for me. I'm going to be the same person I was before. And I know what they're going for. What they're going for is pregnancy is a normal human experience, and we can't pretend that pregnant people are like weak and can't do anything, but also I'm very alarmed that, your body is changing. We need to acknowledge that. We want to work with that. You're not going to be the same person that you were after you have this baby. If that's what expectation you have, whether it be physically, whether it be emotionally, whether it be your daily routine, you are setting yourself up for postpartum depression. Like that's like a total setup for that.
Right?
Yeah, Kara, that makes sense. A little bit more about not just learning how to, I can tense my muscles, right? I can tense my biceps and I can contract my muscles. Can you talk a little bit more about the way you were learning through biofeedback, through diaphragmatic breathing, through mindfulness, or whatever you were doing to release those muscles? Can you talk a little bit about what you mean by that?
Yeah. So I think a lot of this, the CrossFit pieces are just like this athlete brain where it's the whole thing. And there is a little bit more awareness in the CrossFit world now with a program called Pregnancy and Postpartum Athlete, which I am a certified coach with them.
Excellent.
And they coach a lot of the mindset is intention now, intensity later. So just because you can do something now, is that going to be the best thing for your body? Like, absolutely you can. And then there's all this other stuff about like, when you're lifting, and you're doing CrossFit, you work really hard to make like an efficient bar path. But when you have a belly, like you can't, your belly's in the way. So like we have to change things up and adjust things and modify as you get further on into your pregnancy. And yeah, like absolutely. Can people deadlift super heavy when they're further along in their pregnancy? Like physically, yes, absolutely. Is that putting a lot of pressure down into your pelvic floor and a lot of stress on like your ligaments? Also, yes, definitely. And then there is also that tension piece where you're holding so much tension in your abdomen and you're holding so much tension in your pelvic floor to use that pressure management system so that like you're not like peeing yourself or you can brace for those heavy loads. That is certainly putting like so much pressure down into your pelvic floor, particularly if you aren't using a program that teaches you how to do this stuff and coordinate and modulate that pressure system appropriately to be moving those heavy loads. So as far as learning how to like release and relax your pelvic floor, your pelvic floor works in concert with your diaphragm and your transverse abdominals. That's your deep core. And your diaphragm and pelvic floor sort of work together as sort of like this like pump system. So when you take a nice big deep diaphragmatic breath, your diaphragm will move like down into your abdominal space, pulling your lungs down, getting more air into those lungs. And then also as your pelvic floor, as your diaphragm moves down into like a flattened state, your pelvic floor is also going to move down as well. So if you're taking a nice big deep diaphragmatic breath, sometimes if you're super in tune with your body, you can sort of feel that gentle moving down, dipping down into that like your pelvic floor. The best way to do it is to like get hands-on with yourself. So two super great things you can do is just take your hand, place it on your perineum. When you take a deep breath, see if you can feel like a gentle fluttering sensation when you breathe in, feeling that pelvic floor push into your hand gently, and on your exhale, see if it rebounds back up. Some other things that you can do if you have like a kid's ball, then slightly deflate it. Sitting on that, placing like the ball on your perineum on like a hard chair can also give you a lot of great like biofeedback as you're taking those nice big deep diaphragmatic breaths. It's a lot of people are really not in tune with what their pelvic floor is doing, so all of this sounds like a different language to them. Just because like, you know, your pelvic floor and your vagina and your perineum are like, to many people, like this taboo thing that we just like don't talk about. But the very best way for you to get in tune with your body is to just like be hands-on with yourself. Yeah, so those are some really great ways to try to practice that like release and relaxation. There's like so many things that you can do. I actually have a really great handout that I'd be happy like to share with your listeners with some more little exercises that you can do. But the best thing you can do is just like be hands-on with your body. Yeah.
You know, and without naming any names, there's actually a lot more products, I feel like, right now this year compared to 2 years ago that are on the market. And maybe because I do what I do, they're all in my Facebook timeline, so I'm seeing them. So maybe they're not as pervasive in our culture, but you know, they're definitely more available now, right? Would you agree? Like more pelvic products, but you don't need a product to do this stuff, you know?
No, there's a lot of trainers.
A lot of money.
Like the pelvic floor trainers, not like a person, a product. But the trying to, but the issue is, sometimes you may think like, for example, if during pregnancy or during postpartum, you're experiencing some like stress incontinence, you might not, that could be for a variety of reasons. So it could be because your pelvic floor muscles are weaker. It could be because they're too tight. It could be just because of discoordination, and a device is not going to be able to tell you that information that you need to know, and in turn won't be able to tell you what to work on. So if you're using one of those trainers and your pelvic floor is actually too tight, you're just making your pelvic floor more tight. So that's not going to necessarily help the problem. the very best thing that you can do, and what I tell all of my clients to do, and what I have done personally myself, is to, if it's accessible to you, go see a pelvic floor physical therapist and get some information from them on what the status of your pelvic floor is. They will work with you during pregnancy. They will work with you during postpartum. I worked with my PT during pregnancy. I had a lot of SIJ issues. And
So SIJ, so say what that means.
Sacroiliac joint.
Mm-hmm.
And so that's like your lower back muscles, your lower back joint, the bones of your pelvis. And I just had like so much lower back pain. Just like sitting was super uncomfortable all the time. And I'm a person who has a hypertonic pelvic floor. So my pelvic floor is more tense than a lot of people. It's on the more tense side. So I had to work with her to learn how to like release, relax, do some internal work and calm all that down, which helped my symptoms a lot. Yeah.
Pelvic floor PT should be standard care for pregnancy and postpartum people. It really should, because I went to Partners in Perinatal Health conference a couple of years ago, and some pelvic floor physical therapists were doing a presentation, and I went, and I thought it was, pelvic floor PTs help you with like painful intercourse and, incontinence of urine. And it's so many body systems, and the health of so many body systems for men and women.
Yep.
Are connected to how tight or how loose your pelvic floor is. Things from constipation to pain to lower back pain. You're even saying, it doesn't say, how's that related to pelvic floor? Well, if your pelvic floor is, too weak or too tight, and you're overcompensating with different parts of your body to kind of hold your core up. I mean, your pelvic floor is the bottom part of your core. If your core is weak in different areas, diastasis recti, separation of your abdominal muscles in the front, like these are all things that your body is very smart. It's trying hard to keep you standing. And so it's going to compensate in different ways that might exacerbate problems for you down the line. So I really think it should be standard of care.
Yeah, I agree. I had an experience. So my son is 17. So when I was pregnant with him, so 17, 18 years ago, I had a part-time job working for an unnamed hospital and helping them kind of set up classes that they could do in the community. And different care providers, usually doctors, would be coordinated by me. Me and my colleague would call them and be like, hey, do you want to do a little class for free for the community? Do you want to do it here? And we had lots of different locations that we were trying to do it for. And one of them was pelvic floor. And at the time, I don't remember there being any talk of pelvic floor PT. And I remember having conversations with some of these doctors about, and like sort of putting together their, helping them with their PowerPoint and like, what do they talk about? And it was very much like, well, nobody should be having a vaginal birth anymore anyway. It tears up your pelvic floor. So we're having to do all these surgeries after these people push these babies out. We're having to do all these surgeries to fix their pelvic floor. And they were like, their specialties, they were obstetricians who were further specialized in pelvic floor surgery. And there was a whole department of just pelvic floor doctors, and that's all they did. And of course, like any profession, right, you have to be careful. If that's all you see, you start to think that's all that is.
Yep.
Right. But I feel
and also, I mean, side note, the history of the way we treat women in birthing people during the labor process, pushing on your back with an epidural, forceps, episiotomies, they're not blaming any of that.
No,
they're just saying, oh, it's because you pushed it out of your the JJ. So everybody should just have
blaming
C-sections.
They're not blaming it on the third degree episiotomy that you had, or the deep tear that you had for the unnecessary lithotomy position. Blah blah blah.
God, that's horrifying.
Yeah. Right? Yeah, and so it's improved, and I know that there's just so much more talk about pelvic floor physical therapy and pelvic floor exercises, and it's not about Kegels anymore. Kara, can you speak to the whole Kegel thing and how that's out of fashion now?
Yeah.
I think,
so
right?
First of all, is it Kegel or Kegel?
I say Kegel, but you can say either, I think.
What?
So first of all,
so what's the scoop on the Kegel?
Yeah. So the research has shown that actually about 1/3 of people, actually now I'm questioning whether it's 1/3 or 2/3. A lot of people do not do Kegels correctly.
Correct.
So yeah. So
right. Absolutely.
Yeah. So when you're doing a Kegel, I call it a pelvic floor activation.
Right.
You're going to do a close and a lift. So it's as if you're like picking up a blueberry or sucking up a straw. So it's not just like squeezing as tight as you can. Like if you Google it, it says to stop the flow of urine, which please like don't do that. That's not good for your pelvic floor or your bladder. But a proper pelvic floor activation, a proper Kegel is a close and a lift.
Isn't it a release after that too? That's what I had learned back in the day. So what's the update? It's not just like pick it up and hold.
Yeah, you don't want to hold
blueberry.
it. Yeah, no, you don't want to hold
you
it.
pick
Yeah,
it up,
after
so it's
always
repetitive.
release.
So
Yeah.
because the part, and tell me if this is right anymore, what they're thinking. Because if, as a childbirth educator, you know, it used to be like, okay, let's teach people how to do proper Kegels. And then it was like, okay, let's transition that to don't just hold the Kegel, release it and sort of go and like sort of release that muscle, because too many people were tightening for a really long time and then they'd go to push and they didn't know how to let it go. Right.
Yeah.
So then it was release. And now we've evolved to don't do Kegels at all. But it sounds like you're saying you could do them if you're doing them correctly.
Yep.
But tell me more about the release part of it.
Okay. So the release part of it is super important. Number one, if you're a person like me and you have a hypertonic pelvic floor, if you are a person like towards the end of your pregnancy, right around like 34, 35 weeks in my programming, like we don't concentrate on activations at all. We're focusing mostly on like releasing, relaxing, opening, that sort of thing.
Awesome.
Yeah. So we want to make sure that your pelvic floor is strong enough to withstand all of the pressure that your organs are putting on your pelvic floor, but also that you're able to release and relax and let that baby out more efficiently, right? So you're really focusing on, like, if you were imagining that like your vagina was a flower, you want to try to like blossom open the flower, like opening and releasing. Another good cue is like if you are in a deep squat, you want to imagine that your pelvic floor is like dropping towards the floor. So the more that you're opening and relaxing and releasing and blossoming, all those words kind of like mean the same thing, but different analogies work for different people. Once again, the best thing that you can do is be hands-on with yourself. Even like if you feel comfortable taking like a clean finger and inserting it inside your vagina, and see if you can, on that activation, squeeze around your fingers. And then when you're taking a nice deep breath in, focusing on like blossoming, see if you can move away from your fingers. Like the more hands-on you can be with yourself, like the better, the more information you're going to get about like where you stand, what's easy for you, what's more difficult for you, like what you need to maybe work on a little bit more, if you have any questions, that sort of thing.
And how much room you have in there.
Biofeedback is so important.
Yeah.
Like you're saying, like you're it's, we see this in labor a lot. Like if you were a doula or a nurse, you might be telling someone like, relax your shoulders, relax your shoulders, relax your shoulders. And they're like in labor land and their shoulders are up by their ears. And if you take a single finger even and just say, no, right here, this is where I want you to go loose, right? It registers to your brain in a different way than the words do. And so the way you're describing, like being hands-on with yourself, putting your hand up against your perineum, inserting a clean finger into your vagina and trying to figure out, is this what, oh, that's what it feels like when I release. Oh, now I know that's what I have to do to make it feel like I release. It's very helpful for your brain to have that tactile biofeedback.
Totally.
And can you talk a little bit about breath? Because the activation or the release of your pelvic floor, I love the way.
Before we go about breath, though, can you show that model that you have and really explain with words for people who aren't looking at the video, who are listening? Like, what is the pelvic floor, right? It's a set of muscles that sits in our pelvis. But yeah, you've got the most awesome pelvic floor. It's very expensive, this really beautiful pelvis. But I love it. So yeah, explain, show.
Your pelvic floor sits at the base of your pelvis, and it spans from your pubic bone, which is at the front of your pelvis, all the way to your tailbone, which is at the back, and then also from sit bone to sit bone. So it creates like a diamond at the bottom of your pelvis. So like I said before, your pelvic floor muscles work together with the other deep core muscles, which are your diaphragm, your transverse abdominals, and your multifidus, and they provide support and structure to your bony pelvis. And your pelvic floor plays a lot of important roles like bowel and bladder and sexual function, and then also like supporting your pelvic organs. So it forms kind of like a hammock for your bladder, your uterus, and your rectum. It has 3 layers, the superficial and deep layers at the superficial, the middle layer, and then the deep layers of your pelvic floor. And these muscles are, they have like just a lot of different jobs, like blood circulation, like I said, pelvic organ support, load transfer. So when you're moving and walking, every time you take a step, every time you move your body, these muscles are anticipatory. So they'll turn on to sort of activate and provide stability to your pelvic bones. And then also obviously like birthing a baby and sphincter control for peeing and pooping and birthing a baby. And then that abdominal pressure regulation, like I was talking about before. So these muscles, when you're lifting heavy things or when you're running, walking, dancing, anything, it's going to turn on to help modulate that pressure within your intra-abdominal system. So your pelvic floor can do 3 things. It can contract, like we were talking about with those pelvic floor activations. It can relax and bulge. So that's like that pushing sensation. When you breathe in, when you inhale, it lengthens, and when you exhale, it rebounds back up, or if you are activating it, it will contract back up into its resting state. I mean, we could talk about a whole entire podcast about like just your pelvic floor and all of the things that it can do. Like Melissa was saying, if you are a person who is a bicyclist, a horseback rider, a gymnast, a ballet dancer, a CrossFit person, likely a yoga person, chances are that you have a super strong pelvic floor. So just knowing that, you may want to focus more on like this like releasing and relaxing portion of it. So like still do your lifts, still work out, still do your yoga, and then like maybe at the end of your practice, take 5 minutes, 10 minutes to just like relax, do a body scan, see if you can release any tension, do some of those things like I was talking about before, where you're placing your hand on your perineum if you're around a bunch of people and that doesn't feel safe or comfortable to you. See if you can just try to get into your body to see if you can feel any of that movement in your pelvic floor. And yeah, like I said, I have that handout that I'd be happy to share with you as well.
You can also like have somebody shake your butt.
Yeah.
Yeah,
which is a lovely
I love
thing.
that you are providing these services, Kara.
Thank you.
Perinatal fitness services. You know, Beck Conant is a yoga instructor in our state. We actually had her on the podcast at the very beginning. I believe she owns Own Births, but you know, she talks a lot about prenatal yoga or postpartum yoga. It's not just the you know, I remember I used to take step class when I was in my 20s, and you know, there would be someone doing step class and there'd be like, you know, younger people, older people, middle-aged people, and they'd be like, you know, if you've got bad hips and joints, you know, you don't have to step so high, you don't have to do the bounce on this one, you know, they'd give modifications, right? To you don't have to do a deep squat, just do a little dip, right? And for people that had different limitations, that's not what prenatal yoga and postpartum yoga are. And it doesn't sound like that's what perinatal fitness is either. It's not just, oh, you're bigger now, your center of gravity is a little shifted, so instead of doing a hop, you can do a little bounce, right? It's not just a modification of the exercise because you have a belly. It's being mindful of the way pregnancy is changing your body and doing things to help you learn how to support it in the best way, right? Like, you know, do your yoga, but then learn how to relax that pelvic floor, because that's going to be a very important part of your labor experience.
So you've actually put together programming where people can go to your website and they can purchase a program to work with you one-on-one or to work in a package. So tell more about that and sort of like the pregnancy pieces versus the postpartum. When does it start? What do you offer?
Okay. So there's a couple of different ways that you can work with me. Right now I'm focusing more on my one-on-one clientele, just because I want to be able to just see you in that full humanness. And I think that requires more of like a one-on-one approach versus a one-off PDF downloadable or a sort of like group programming. I do have a postpartum program that you can do that intentionally integrates you back into exercise after you have delivered your baby. That's a downloadable on my website. And there's a lot of great information, like we've been talking about your pelvic floor and your core and breath work and all that sort of stuff. And then also 8 weeks of programming to guide you back into exercise. You can start that around 4 weeks. Generally, I like people to be done bleeding before they start exercising again, but there is some flexibility there. I'm available as support if you have questions about that. And I also have a program called Untamed Motherhood,
I love
which
the name of that.
thank you. It's an intentional movement practice for moms. It's a space you can go if you're sort of craving movement, if moving your body makes you feel more connected to yourself. And with that program, you get access to a library of curated videos where I am going through the movements with you, guiding you through that so you can just sort of turn off your brain and move your body. And the videos range from 5 minutes to 30 minutes. You use minimal equipment, and they incorporate a lot of breath and mindfulness. So it's for anyone who wants to feel more grounded in their body. And I made it during COVID because I just wanted to create a place for people to go where they can just like move and breathe and be, because all of that feels really hard right now.
Yeah, and you give like little hints to you show hints to that on your Instagram. I see them once in a while.
Yeah.
Yeah. You know, you could show on like you're exercising or stretching.
I love this motto. I love this motto, intention before intensity. And I love how you said, you know, this program that you have, especially the postpartum one, is a way to help you learn how to intentionally move your body in a healthy way to ease you back into an exercise, but also appreciating what your body just went through and how amazing that is, and how can we support it best. It takes 9 months to grow a baby, and it takes at least 9 months to start getting back to the way things were. And some things are never going to be the same. I mean, our rib cages, you might be a full band size bigger, bra band size bigger for the rest of your life, even if you go back down to your pre-pregnancy weight, because your rib cage has permanently expanded because you've grown life. And, you know, my grandmother, 87 years old, always said that. Takes 9 months to grow a baby. It's not going to bounce back right away. And so
well, fortunately,
I love that, this intention before intensity.
Fortunately, your feet also oftentimes grow, and so it gives you a much more firmer grasp for all this fitness you're going to do.
There you go. Yeah, that intention now, intensity later. That's a phrase coined by Brianna Battles, who's founded this pregnancy and postpartum athlete. She's also a really good resource for pregnant and postpartum CrossFitters. And yeah, it's really all about that like intention, because another like really just I just want to bang my head up against a wall thinking about it is this 6-week checkup where like people you get cleared,
right?
And then people just jump right back in. Yeah, you jump right back into like your
and they're
gym
riding
classes,
30-mile Peloton rides. Yeah, and I'm like, oh my gosh, please don't just start jumping on your Peloton.
Yeah, some huge shifts have been occurring in your body. So like, let's make sure that that we're rehabbing essentially from birth and labor and pregnancy. You know, birth and labor aren't like an injury, but they can be injurious in nature sometimes. So, you know, let's make sure that we're being intentional about the way that we're navigating this, because it does, you know, it can affect you for like the rest of your life.
Absolutely.
Yeah. And I'm glad that you don't encourage people to start this program of yours postpartum until they're at least 4 weeks. And I said sometimes people will do it sooner if they stop bleeding. I would like to just reiterate from a nursing perspective how important it is to wait till at least 4 to 6 weeks, because your placenta is the size of a salad plate, right? And it leaves a placenta-sized wound in your uterus, and it takes time for that wound to heal. And around 3 weeks, that's the time when a lot of people, you know, especially if they've been really good about staying in bed and resting as much as possible for the first 2 weeks, they get to 3 weeks, they're barely using a panty liner, they've got cabin fever, maybe they have other children, and they're like, boom, I'm just going to go back into taking long walks, you know, down the Charles River. And, you know, then they call me, ring, ring, triage nurse, Melissa, I'm bleeding clots at the zoo. And I'm like, first of all, you had a baby 3 weeks ago. Why are you at the zoo?
Yeah.
Because they thought, oh, my bleeding stopped and my perineum feels fine and I'm not. And so they're back at going full force. And, at 3 weeks, a lot of people have like a big shift in their uterus. Their uterus does like a big shrink. And especially if you have been pushing it, use your bleeding as a barometer that, if you start to pass clots, if you start to have to use a pad again, when for the past few days you haven't, that means you need to dial it back. You need to slow down. You need to let that wound heal, because you're going to be better off for it. Like you said, these things can have effects on your health for the rest of your life. So people get this false sense of I'm healed at 3 weeks, when really that's a time when a lot of moms who have had babies before call with bleeding. So just my little PSA, so I'll get off my soapbox.
Yeah. And you'll get back to doing all of the things.
Body.
Yeah. And you'll get back to all of the things that you wanted to do. I don't want to be like shaming anybody for like getting back into exercise. I understand that desire to move your body again is like so real. And especially when you've been cooped up with babies, it's just like, you just want to like crawl out of your skin. Like I have been there. I get it.
Yes.
So for example, after I had my daughter, I started just running too soon. I was doing like sprint intervals, and I had just horrible pubic symphysis pain that I had to go to PT while I was postpartum, because it hurt me just to like walk up the stairs. So we want to make sure that like, and I felt great. And I was like, oh, I'm going to run again. And then all of a sudden I couldn't like chase after my kid in a parking lot. So you just want to make sure that we're doing this with intention, because if we're doing things with intention, then we can do the things that we want to do more like faster than we initially think, and then for longer than we think. Does that make sense?
Mm-hmm.
Okay. Yes. No, it does absolutely make sense. Yeah, I don't mean to give anybody the impression that I am judging or shaming.
No.
I am a type A doer. Like I know what that cabin fever feels like. My first baby was born on Christmas Day, and it was a dark, cold, snowy winter. And, I was going cuckoo bananas. And exercise is so good for so many things, especially a lot of people's mental health. That's how they cope, with feeling mentally well. And when that's kind of abruptly taken away from you after you give birth, it can be very unnerving for a lot of people. We just want you to know, and that's why I'm so glad. I hope people will go to your website, karacoffin.com, because there's not, like you said, when people Google how do I get back in shape postpartum, it's how to be beach body ready in 6 weeks. And that's not what we want. That's not good advice. That's harmful, unhealthy advice. So people are doing what they think they're supposed to do. I should just pretend that this never happened and get back on the Peloton bike. But
on the other hand, though,
you can enjoy that bike.
Right. On the other hand, there's the opposite spectrum of people who don't want to exercise, but really do need to at least be working on getting their core back in shape. And without that sounds so daunting to a non-exerciser or a person who, like, I exercise, I don't like to do it. But, like when you say core exercise, like I don't want to do core exercises, but I've learned since that
you're thinking like sit-ups, right?
Yeah, but there's really gentle ways, very easy transition into working to get your pelvic floor back into shape, and very gentle and easy things you can do just with your everyday life to work on your core. And those are the kinds of things that you, Kara, and sometimes a physical therapist might be needed, but like simple things. So it's not stressful. So you're not like, oh, I guess I have to go do this and that and the other thing, and like typical workouts. Or people might be avoiding doing any workout at all because they're dreading what they think you're going to tell them.
Right.
When really it's actually not that hard.
Yeah.
So it can go both ways. Like it's more gentle than maybe someone who's like, yeah, fitness, really into it. But it's also really gentle for people who aren't ready, or maybe never want to be ready to do full fitness stuff.
Yeah. There are so many things that like everybody should do in that early postpartum period. And it's not even like, let's get down on the floor and do some glute bridges. It's like, let's just build some awareness.
We're not asking you to do burpees here.
Yeah, no, none of that. I don't even like burpees. So things like, let's just build some awareness around what our own natural tendencies are. So like when you're holding your baby and you're getting up off of the couch, be aware of how you are managing pressure in your body. So when you're getting up off of the couch, are you holding your breath? Are you sending pressure down into your pelvic floor? Are you breathing throughout your movement? So just being aware of some of those things that you are already doing when you're lifting the car seat, when you're lifting the groceries, when you're bending down to tie your shoe. Like, let's be aware of the pressure management strategies that you're using. And then from there, with that information, we can try to like change things up. See if when you get up from the couch, you could do like a gentle activation of your pelvic floor. See if when you're going through that movement, you can like tense your abdomen and like breathe out to try to disperse that pressure a little better. These are all things that you can do in your day from day one when your baby is born to get you more connected to your pelvic floor, to regain some of that coordination, to just overall get more connected with your body. Because after you have a baby, there definitely is this sense of just like hollowness, disconnection in your abdomen. Like you have to like train your brain and your body to communicate with each other once again. Everything's been shifted and moved, and you know, and you have this like new baby that you're taking care of and all this other stuff. So just some really simple things to build some awareness around your body from the get-go. And none of it has to be, you know, if you want to, we can make some different programs to get you like doing actual like exercises on the floor, which are also wonderful. But if exercise is like not your jam, there's a lot of things that you can do to help your core and pelvic floor that are not like, let's go do a workout. Some of the best positions to gain awareness in your pelvic floor is to get into like a nice wide leg child's pose position. And you can really feel that pelvic floor sort of moving, lengthening and contracting on your breath. Like I love lying on the floor. I really do. It's a wonderful thing.
That's all we have to do is start there. Huh?
That's amazing.
Yeah.
Do you have any last kind of take-home messages, Kara, that you want our listeners to know about you and your business or about your specialty in general?
I think that one of the most important things is to just make sure that when you are like working with a trainer or considering a program and you're early postpartum, just think about like if it's something online, like what is the messaging that they're sending you? Is it telling you that you need to get smaller and that you need to like you have to do these things? Are they throwing like harmful imaging at you that are rooted in diet culture? Or is it something that is more supportive to you in this like new identity as a postpartum person, as a caretaker of a small infant, those sorts of things. And then if you're working with a trainer, just like do a little investigation, like ask them a little bit about their qualifications in working with pregnant and postpartum people. Because sometimes people don't even realize like how much they don't know as a trainer. And you want someone who really like gets all of these pieces of like the social emotional aspects of growing a baby and birthing a baby, but also the body dynamics and pelvic floor and core and all that good stuff. So I think that's a pretty good takeaway message from today.
I know you have a lot of certifications, but there was one you mentioned in particular that maybe people could look out for if they're not in your area and looking for somebody in their area. What was that certification that really gave you a lot of knowledge specifically about pregnancy and postpartum fitness?
The two that I would highly recommend to people would be the pregnancy and postpartum athlete or pregnancy and postpartum athleticism, which is by Brianna Battles. It's mostly a lot of people gravitate towards that certification if they are CrossFit instructors or athletes, but she does also give a lot of information for like anyone who just wants to move their body postpartum. And then also Jessie Mundell's postpartum postnatal fitness specialist certification, which is just this beautiful holistic approach to pregnancy, postpartum, and everything that goes along with that.
All of your stuff is available online as well.
Yep.
Yes,
awesome. Well, thank you.
KaraCoffin.com.
Yes. Keeping it easy for people to find me.
Right. Yes. Kara with a K and Coffin with a C.
We hope you have all enjoyed today's show, and we hope you will tune in again. Remember, Babies in Common is a community for you. After all, we all have
babies in common. Awesome.
Thank you again, Kara.